Good evening. This is a virtual meeting of the North Andover Board of Health, Thursday, February the 25th, 2021. I'm Joe McCarthy, Board Chairman, and there is a quorum, but a roll call is required. So I'll start with Michelle Davis, clerk.
I'm here.
Dr. Pat Scanlon, town physician.
Present.
Daphne LaFleur.
Here.
And Dr. Max Tilson. Is Max with us now too?
He was.
Just left on the bottom. It said he just left, but now he's joining.
He's back. He's back.
Okay. In addition, the department members in attendance, Brian LaGrasse, he's the director. Brian, is Stephen Casey with us, or will he be with us?
He should be.
He should be, okay. Carolyn Iverson, she's the town nurse. And Tony Wolfenden, she's the town assistant. In addition, Officer Gordon, Sergeant Daly, and Susan Egan will be joining us for the hearing. So the meeting is called to order, but the first order of business is the following statement from the governor, which has to be read at virtual meetings. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their television by turning to Comcast Channel 8 or Verizon 26, or online at www.northandovercam.org. No in-person attendance or member of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event we are unable to do so, despite best efforts, we will post on the Town of North Andover website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public would like to participate, please email your comments prior to or during the meeting to blagrasse@northandoverma.gov. That is blagrasse@northandoverma.gov. The comment will be read during the proceedings and responded to accordingly. So the meeting is open. First matters to be addressed are the approval of the meeting minutes from January 28th, 2021 and December the 17th of 2020. Michelle?
The minutes from December 17th, 2020 and the minutes from January 28th, 2021 have been reviewed, edits have been made, and they are ready for approval.
Okay, is there a second?
Second.
All those in favor say aye.
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 All those opposed say no. The minutes have been approved. We're going to segue to the appeal hearing notice of violation. Adam McClellan, who's also joining us right now, and his address is 115 Windcrest Farm Road. And for this, a motion is required to open a public hearing. Is there such a motion?
Motion to open.
Okay. Is there a second?
Second.
Okay, this motion to open a public hearing has been seconded. Those in favor say aye.
Aye.
Those
Aye.
opposed say no. Okay, so we're going to open the public hearing right now. Before we do that, I just want to quickly go through a couple of relevant points for the members of the Board of Health, some of whom are relatively new, and anyone that may be listening in. As a reminder to the Board of Health members, if any of you are a friend, relative, or business associate of Mr. McClellan, you'll have to recuse yourself because of a potential conflict of interest. This is how the hearing's going to go. Brian LaGrasse, who is the director, will review the incident and present each of the 3 violations. Mr. McClellan will discuss why he feels the violations should be withdrawn. Brian, Suzanne Egan, Officer Gordon, and Sergeant Daly will then provide relevant data and clarifications. Board of Health members will ask questions. When there were no further questions, the Board of Health member will make a motion to accept none, part, or all the violations. Board of Health members can discuss this motion. Another Board of Health member will second the motion, and Board of Health members will vote on this motion to find Mr. McClellan responsible or not responsible. There's a lot to it, but unfortunately, this is the way that it has to be done. So Brian, at that, it's all yours. Talk about the incident and violation.
Thank you. Just to give you a brief summary, Ms. McClellan had a New Year's Eve party that the police responded to on New Year's Eve. I got the police report shortly thereafter, and obviously in the report there was notations of violations for the governor's orders, gathering, mass social distancing, things like that. So it was pretty well publicized. It was in the paper. We got a lot of calls on it ourselves here. But on January 12th, I sent a notice of violation to Mr. McClellan and assessed fines for each of the different violations. He has since appealed that, which is why we're here before the board to hear his appeal. So I'm going to pass it off to Adam, and he can give you a rundown of what his take is and what his appeal is, and we can go from there.
Adam?
Well, thanks, guys, and I appreciate you guys taking the time on this as well. I want to just first make it clear. I think the idea of throwing a party during a pandemic, not a smart idea. I'm not going to argue that COVID is not something that shouldn't be taken serious or anything of that nature. I think it was a dumb idea. Won't do it again. Have no interest in doing it again. How it sort of came together is I have a small group of friends. As New Year's approached, we were kind of all exchanging ideas. What's happening? Is there anything going on? And of course, there was just nothing going on. And I started hearing from different groups of friends that I have. They were planning on getting together here, there, wherever, and kind of planning something. My understanding when the mandate came out was that it was a guideline, or it wasn't something that was a law that was put in place. And if I'm wrong on that, then I guess I just wasn't informed or didn't understand it correctly. So it definitely ended up getting bigger than I was sort of anticipating and expected. But I do want to make it clear as well. We took a lot of precautions. When the police came and we talked to them, I went out peacefully, completely cooperative. When I went out and first talked to him right out of initially, he said, "Yeah, we're probably gonna have to shut you down." And I said, "That's fine. If we got to shut it down, we got to shut it down." After talking to the sergeant, when the sergeant eventually came, they eventually ended up leaving and sort of not encouraged us, but I think they saw the logic that I said, if we disperse this thing right now, they're all just going to go somewhere else. And, a lot of these, my friends that are here, the people that are here, they're determined to get together tonight. And I was trying to provide a safe environment. I have a 5,000 square foot home with a big open concept. I have a large enclosed patio in the backyard. I have a massive garage that we cleared out space to add extra space. We took everyone's temperature check at the door. We told everyone, do not come if you're showing any signs of sickness or COVID or any sort of symptoms. We put 6 feet apart stickers all over the floor of the home. We put them literally everywhere. My kids helped me, and we probably put 200 6 feet apart stickers all over the home. My kids literally used a 6-foot ruler and were putting 6 feet apart stickers all over the house. We actually had people sign a waiver stating that they didn't have any signs of COVID or anything like that before they came. I feel like we took a lot of precautions, in doing this. And I was admittedly apprehensive to do it in the first place. But the more I started hearing, the opinion of like a lot of the people that I'm friends with, they were determined to get together. And I'm divorced. My ex-wife lives in Andover. We lived there for 5 years, and I just bought this home in last February. And I didn't have my kids that weekend, and said, I've got I don't have the girls this weekend, and let's just do it here. We'll keep it low key. And I am happy to report that we didn't have a single reported case of COVID from the event. We checked with everyone within 2 weeks after the event was over. We didn't have a single reported case from the event. And I think overall, when the police came and we talked I went and spoke with them for a good 15, 20 minutes in the front yard. And I think after they just saw that, this wasn't like an underage situation or any sort of risk in terms of like noise ordinances or anything like that, they realized it was a pretty peaceful gathering. And, they basically just said, hey, just make sure nobody else comes. And I said, totally fine. I'll make sure we put out the word that nobody else is, welcome to come. And I feel like we did a pretty good job managing that. And we had it was a peaceful, and it was a nice evening, and everyone had a great time. And so I guess where I'm coming from on the whole thing is I understand at first glance, like hearing that there's this big party going on and this and that, like how it looks, totally get it. And I actually don't even disagree with, that sentiment. But I think for the people that were here, and even my neighbors, and I've asked one of my neighbors to be on the call. And by the way, I knocked every door of my street on Christmas Day, delivered Christmas presents to all the neighbors, and I let every one of them know. I said, hey, I'm planning on having a little get together at my place on New Year's. I just want to double check. I said, we're going to be right. My understanding, even from the mandate, was it was 10 people indoors, 25 outdoors. And we definitely exceeded that. But I said, I just want to make sure you guys are comfortable with it. There might be cars, kind of parked, away from my house or whatever. Every neighbor, totally fine. You're good. And especially my immediate neighbors on all sides assured me they were totally fine with it. And even the article that came out, if you've read it, there's not a single quote in there from any of my neighbors. And I wasn't home actually when the woman came around knocking on the door. I wish I would have been, because there's a lot in that article. It's not accurate. But anyway, so I just a part of this for me is I think it's been overblown a little bit. I think the perception of it is much worse than what the reality was. And I think $4,000 for a fine, when I feel like I honestly was creating an environment that potentially, prevented, Corona. I mean, I try to create as safe as environment as possible for this situation. And anyway, so I asked one of my neighbors to be on, just if you guys care to hear his perception of it. I think he'll have no problem letting you know that there was never a noise issue at any point or anything like that. And anyway, so I don't know if
I'm here.
Go ahead. Yeah, and this is Chris Jennings, my neighbor next door or across the street.
Actually, hi, sorry, it's Pat. I just have one question for Brian. Brian, is the police department responsible for breaking up a party strictly because of the governor's mandates, or are they only just required to suggest something? And then, of course, break up a party if there's like noise complaints or something like that. But I'm more specifically talking about mask violations and the number of people at a party.
No, they refer that to us. They respond to noise complaints and things like that, such at Royal Crest, in this case, 115 Windkist. And then they do what they have to do for the party or for the situation at hand. And then they send me the report after and subsequent to the event. So I didn't hear about it for a few days. And then I take it from there for any of the governor's orders that we're responsible for enforcing.
Okay. And Adam, I just want to let you know, I didn't even know that this even happened until I was handed the notice, and I didn't even read the article. So I didn't even know there's an article out there. So it's impartial for sure.
I appreciate that. If it makes you guys feel any better, I've definitely heard about this from my ex-wife numerous times. She's not been happy with, the exposure and everything else. And I've been tested for COVID at least 4 times. With my work, I get tested pretty regularly as well. So anyway, I've definitely been on the receiving end of some verbal chew outs, but that's okay. So I get it. I understand. Again, dumb idea. It definitely spiraled a little further than I was expecting it to, but I do feel like we worked really hard to keep it well in control and take every precaution. And by the way, I just want to say this too. Some of the allegations in the actual fine, the police, they never came in the home or anything like that. So a lot of the people in the home were wearing masks. I would actually say the large majority of them were wearing masks in the home. I spread out. I pushed all my furniture against walls. Things like that. I created as much space as I possibly could, and I completely again enclosed my back patio. I had heaters out there so people could be outside. I mean, we did everything we possibly could to create as much space as possible for people to be able to maintain distance from each other. And it's a large open layout Rambler. I mean, there's a massive amount of space on the ground floor and in the garage and in the back patio. So anyway, sorry, Chris, I know Chris was going to chime in.
Mr. Jennings, could you give me your full name and your address, please, for the record?
Sorry. It's Christopher Jennings at 120 Windkist Farm Road.
Thank you.
Adam asked me to come on to make comment on the noise. So I live directly across the street. I mean, we look in each other's windows across the street. We couldn't hear anything from our house. So Adam asked me to come on to make comment to that. I'm very comfortable making a comment to that because there was a lot of cars, but outside of that, there was no disruption to the neighborhood that I saw.
I don't think the question was ever the noise. The question and the allegations that we're talking about is more the size of the party based on the governor's orders and mask violations. And I guess I don't know, Brian, if you could just maybe elaborate on each individual fine and what charge it was.
Yeah, under the governor's orders, they give us some leeway. For each order, it can be up to $500 per violation, such as a social distancing, mask wearing, gathering limits, things like that, even capacity limits at restaurants. All that stuff's under different governor's orders. And we have the ability to fine and issue violations under those for up to $500 per violation, and then under Mass General laws as well, which goes up to $1,000. So I did 300 for each one of the violations, and then 1,000 for master and loss for each one of the violations as well. It comes out to 3,900. So basically, a breakdown as to what I gave. It's basically $1,300 per violation. It was not the maximum, but it was substantial, and I knew it would get people's attention. And I know after the publicity, there was a lot of people that were very upset, and it was one of those things where we had to act quickly to get this taken care of and at least get the dialogue rolling with this.
This is Joe. Brian, and actually to Adam, that was a good update and review. Thank you. But these are not guidelines. These are regulations, and you seem like a very smart man. And I scratched my head saying, well, why didn't he know that these are regulations? There are regulations for social distancing, for wearing masks, for limitation of the number of people in a gathering. But you weren't aware. Yet you had that party that seemed to have been of relatively large size, certainly more than 10 people inside and 25 people outside. And Adam, you also mentioned noise ordinance. There wasn't much noise, but correct me if I'm mistaken. I thought there was a complaint from a neighbor on noise.
Not to my knowledge.
I guess you can you can ask the police department to chime in as to what their situation was and what started the whole thing. If sergeant or officer want to give us their 2 cents.
Sergeant Daly and Officer Gordon are both here together. We received a few phone calls. I do not believe that a neighbor actually called. We received a call the night before about the party. I think someone maybe wasn't invited or whatnot. I'm not sure, but it's never been verified that a neighbor actually called.
I think at this point it might be helpful for the officers to relay their experience of that night and just report on the incident, report that they drafted and provide the board with their perspective.
Okay, so we'll start with Officer Gordon because he was the first one that was up there.
How you doing, folks? I'm Officer Gordon. And to my recollection, again, about 9:15 that night, I had responded to Windkiss Farm Road. We had received a call at that location in reference to noise complaints. Like I said, Sergeant just said we had responded to getting a couple complaints in the area, again, unverified as who was calling at that point in time. But as I rolled up, I could see the cars in the driveway. I could visibly see that there was a gathering going on. There was a couple party buses also up there. So as I kind of rolled around, kind of just took a lay of the land there. Mr. McClellan did actually come out. I did speak to him. He was very cordial, very polite. I kind of informed him saying, hey, listen, are you aware kind of the governor's guidelines? He said, I thought that, as he stated, he said he thought they were precautionary and not, all inclusive. At that point in time, I kind of indicated to him that, due to the nature of what's going on and the governor's guidelines and the noise complaints that we had that we received, that I was going to have to inform my sergeants and inform the chain of command what was going on. And I took the report, and at that point in time, I contacted Sergeant Daly and Sergeant Scout.
And I just want to chime in, sorry to interrupt. I gave the officer my cell number as well at that point and said, hey, just shoot me a text or a call if he actually informed me. So why don't you head back in and I'll ping you once I have more information.
Also, too, there was another, actually, it's a guideline, not a regulation, that any gatherings as such have to cease after 9:30 at night. And you certainly went on after that time. But again, that's not a regulation, it's just a guideline. I will admit that there were so many guidelines and regulations that it's hard to get a grasp on them. But the bottom line is that these are regulations that were violated at your home at that time. What we may want to break them down, because I have some uncertainty on this. So if you don't mind, unless Susan, you want to take it from here, I just want to make a couple of points. A limitation on the number of people, 10 inside and 20 outside. Adam, you admit that this certainly was more than that. Although in the letter that you had sent us, the letter says that you found recourse a hearing before the Board of Health to attempt to have this violation withdrawn. So I guess you're talking about having all the violations withdrawn, even though you acknowledge that indeed there were more than 10 people inside and perhaps more than 25 people outside. The other two regulations, I really don't have a strong feel on, a strong fix on. For example, wearing masks. Now, Adam, correct me if I'm misunderstanding, but you said that at no time did an officer go in your home. True?
That's true, yeah.
Okay. So as such, an officer would not know if anyone in your house was wearing a mask or not. Nor would an officer know if the people in your house were maintaining social distance. And you said that you had markers and indications and you're checking out people before they came and so on and so forth. So one, we know for sure that you indeed had more than 10 people inside and 25 people outside. But the other two, wearing masks and limitations on wearing masks and social distancing, certainly in the house, we don't know. And this is to Susan and the offices and also to Brian. Did you see people outside the house maintaining social distance, outside the house wearing masks? Because Adam has been fined for all these violations. So were people outside the house not wearing their mask and not socializing? Susan, one of the
Yeah, so I think that, we've had an opportunity to hear Officer Gordon, who was the first officer who responded to the complaint. And then Sergeant Daly can also, I think at this point, it would be helpful for him to provide his, what he saw and what he, sort of the activities that he saw going on that night.
Okay, Sergeant Daly here. So when I arrived, it was myself, two other North Andover officers, along with Officer Gordon. We had two state troopers and a sergeant and two officers from Andover in the event that it was going to get out of hand if we had to break up the party. That's not what happened. He was Mr. McClellan was very cooperative. What I can say is when we were outside, there was nobody with a mask on other than the police officers. I don't know inside, I can't speak to it. We didn't go in the house, but that's outside the house. When we pulled up, there were probably a group, if I had estimated about 10 females that were walking in when we were pulling in. There were a few others that came shortly thereafter while we were speaking to Mr. McClellan. When we had talked about him kind of not having more people at the house, myself and Officer Furman went down and staged probably about 50 yards down the street from the residence. And, there were cars coming by after that. Some of them turned around and left. Others went up, and there were a few Ubers or Lyft rides, whatnot. People didn't have masks outside. I don't know what was going on in the house. We didn't go in.
Officer, the people that were outside that were not wearing masks, were they maintaining social distance? Oh, well, some of them very close together.
I would say there was social distance maintained. The only thing I'm confident in is that there were not masks being worn.
Just an update, the gates at North Main and the gates at Marblehead Street are both up right now. I'm not sure if they're functioning properly.
Did you get that?
Stand by at North Main.
Yes, thank you.
Okay.
I just wanted to add, the officers were really easy to work with. I mean, I definitely felt like they were hearing me out and vice versa, and I felt like it was respectful exchange. They're
the railroad is here,
I
so
see many people as they're walking up to the home wearing masks either, but we required every single person to go through my front door, and we actually had a coat. One of my bedrooms I designated as a coat check room, and we literally blocked off any other way to get into the main area of the home, so they had no choice but to go directly to the coat check room, check in their coat, or just put their coat in the room or whatever. And then at that point, they were, there's signs everywhere: wear a mask, put your mask on, maintain distance, all that kind of stuff. So, as people were walking up to the home, there was a story.
Brian, can you? I'm still having trouble wrapping my head around the exact breakdown of the fines because, there are certain things that are proven to be true versus we can't prove, such as, masks inside and things like that. I'm just curious as to the exact breakdown of each amount and what that amount correlates to as to that specific charge.
Okay. So under the orders, I did one for Order 55, which is mandating the wearing of facial coverings, including masks, indoor gatherings and outdoor gatherings. Then the maximum premises capacity for the 10 people versus indoors, 25 outdoors, or 5 people per 1,000 square feet if there's no occupancy limit on file. So both of
How
those.
much was that? Sorry.
Each one of these is for 1,300, 300 under the orders and 1,000 under Mass General Law. So the order itself is up to 500. Mass General Laws are up to 1,000 for those violations, and that's just general nuisance violations for causes of sickness and spreading of disease is what that comes under. So you get those two, and then the last one was social distancing of guests, 300 for the order, and then 1,000 for the Mass General Law. So each one is 1,300. Masks, capacity limits, and social distancing.
Okay.
So this is what, and anyone stop me if I'm off the mark here, but this is what we do and don't know at this time. We don't know what happened inside the house. We do know that these are not guidelines. These are regulations that appear to not have been followed, at least some of them. We don't know if there was social distancing maintained outside. We do know, at least from the police report and statements, that people outside, at least some people outside, were not wearing masks. We also do know that the limitation on the number of people inside and outside the house was exceeded. Have I missed anything here so far? Because each and every one of these items is relevant to the assessment of the fines.
The only thing I would, I guess, add to that is I don't have any control over what anyone does as they're walking up to my property. So if they're social distancing, if they're wearing masks, I don't have any control over that. The only control I had is once they entered the premises and from that point forward.
But it's your property that people that were not wearing masks.
But if they're walking up the street, if they're walking up to the door, it's like.
But someone was gathering on your property outside.
But they couldn't see that. The police could only see.
Police said that people outside did not have their mask on.
In the front yard as they were walking up to the home.
It doesn't matter whether in the front yard or backyard.
But there's no gathering in the front yard. People were just walking up to the door. There was no stopping and gathering in the front yard. It was just people walking up to the door and walking.
Well, the officer said he saw about 10 people outside the house.
Just walking up to the house. That's it. I was outside when that group walked up, and they literally walked right past us. I believe I was speaking with Sergeant Daly at the time, and they walked up and they said, "Hey, is everything okay?" And we said, "Yeah, everything's fine." And they said, "Where should we head?" I said, "Just head to the front door." And they walked up to the front door. They went in. So, I mean, there was no stopping and gathering in the front yard, and anyone once they entered the home was asked to wear a mask and maintain social distance.
I think if they step on your property, the moment they step on your property and if they're not wearing masks, it becomes ultimately your responsibility. Like the front yard, as soon as they step on your grass. I mean, correct me if I'm wrong, but that's my understanding.
I mean, that's fine if we want to get hung up on that. I guess I'm just asking you guys, like, if somebody, you know, is trick or treating and they walk up to your home, you know, you're technically responsible for them for the moment they step on your grass, right? So, they get hurt or whatever else, then. So but you don't have any control over someone walking up to your door and ringing your doorbell, and I don't have.
It's not a matter of being hung up on this. It's just that it appears that certain regulations were violated. It has nothing to do with being hung up. They either were or were not violated.
I guess what I would, I guess, just argue is that, you know, these are adults making adult decisions. They all are very aware what's going on. You know, nobody came to this not understanding that, you know, getting COVID was a possibility. I'm not, you know, a babysitter, but I invited people to the home, and I don't have any control over what they're doing as they're walking up to my property. I only have control of once they actually enter the property and that point forward.
I will say you're correct. Everybody's adults. You don't have control over that, but I would argue that you do have control about having a party in general. And I find that a little bit more disturbing too. You're right, no control over people walking into the house, but you have the control about throwing a party, and that's
okay. But that fair point. But I'm just saying, if me and 10 people walked up to your home right now and we weren't wearing masks, would you get fined? Even if we didn't come in your home?
I understand your argument, but there's certainly a difference between the 10 people and I believe it was about 100 people at the party.
I mean, I don't know the exact number, somewhere between 75 and 100, I would say.
Do you have the waivers of how many people were there that everybody signed coming in?
I don't. They were all just paper waivers and have since been recycled, but I can try and track one down in a PDF or something somewhere. But basically, the waiver was just, hey, I understand what I'm walking into. I'm not going to hold out. I'm liable. You know, I'm not aware of any symptoms or anything like that.
In the police report, there's a comment made by Officer Gordon that, quote, McClellan reported he did not have an inaccurate account, but possibly estimated between 75 and 125 people. So that's right in the police report here. So the bottom line is that more than 10 people inside and 25 people outside were at this party. It can considerably more than 10 or 25. I'm somewhat reluctant to take charge of some of the aspects of the meeting here, because typically in an open hearing meeting, the questions are asked by other members of the of the board, and a motion is made by the board, as I noted earlier, discussed, seconded by the board, and the chairman holds back. He leads people through, the chairman is a facilitator, and he doesn't even he doesn't even vote on these motions unless, of course, there is a tie to be broken. But having said that, I have some ideas, unless there is further discussion, as to where to from here. Is there further discussion?
So,
Okay.
Mr. Chair, if I may, it may be appropriate then if there's no further information that the appellant wants to offer to the board, or that you would like to hear from the officers or from the director, then it may be appropriate to close the public hearing, have a motion to close the public hearing, and then have a motion and then move to discuss the matter. And that way you could take the steps necessary to have this discussion regarding the violation.
Fine. A motion to close the public hearing. Is it seconded?
Second.
Second.
Okay. All those in favor, say aye.
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 Those opposed, say no. So the motion is passed to close the public hearing. Now let's talk about the three violations, and I think we should go through them one at a time to feel, unless you feel otherwise, Susan.
So it may be appropriate to take one as if you would like to do that, you could take a motion on each one, have a second, open it up for discussion, and then have a vote on each one. And then you could go through it in a sort of an ordered fashion.
That will be fine. I make a motion to break down these violations to each of the three. Is there a second?
Second.
Okay, let's start with what we do know, what we are assured of, what is agreed upon by that. And for that, there was a fine of the total $1,500 for master law and $300. There's a lot of background noise here, and $300 from the town. So what we know is that there was a gathering of more than 10 people inside, 25 people outside. Is that disputed by anyone, including you, Adam?
So, Mr. Chair, if you've closed the public hearing, then it would only be appropriate to have that conversation amongst the board members at this point, because
Okay.
all the information from anyone outside of the board, you've gone forward from that part of your meeting, and now it's just the board members discussing the violations.
That will be fine. Is there any disagreement amongst the board members?
No.
No. No.
No.
Okay.
No.
Okay, those are in agreement, say aye.
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 Those who are in disagreement say no. So we agree that the party had more than 10 people inside and 25 people outside. The second one, which we don't have concrete
So I
information.
think we have to stick to this one because we decided to break it down into three.
Okay, so make a motion on that, Susan, right now?
Yeah, so if Michelle or any of the other board members like to make a motion, you could take a second, and then a vote on that particular motion.
Michelle?
What am I making? We didn't make a decision, did we? What am I making a motion on?
Okay, we agree that there were more than 10 people inside and 25 people outside.
Correct. Do you want me to make a motion to agree on that? Okay. I make a motion that we have unanimous consent that there was more than 10 people inside and more than 25 people outside.
Is that motion seconded?
Second that motion.
All those in favor
Well,
say aye.
Aye.
All those opposed say no. Okay, the motion passed. The next one is social distancing. Again, we don't know what happened in the house. We have been told that social distancing indeed was maintained in the house. Was it maintained outside the house? We don't know for sure. Perhaps, perhaps not, according to what we're told by the policeman and the sergeant in attendance right now. So the question is, should we act on something that we don't know if it happened or not? We have been told by Adam that it didn't happen. We don't know. So what are we going to do about that? And I want to leave that open for further discussion amongst the members of the board. And the question is, should we make a fine on something that we believe, but we don't know for sure? To me, that's the question. Susan, am I missing anything here on that?
Well, I mean, I think that the first question is a discussion on that issue to discuss those facts, and then then you have the conclusion.
Absolutely.
So it may be appropriate to poll each member of the board to see if they would like to weigh in on this particular fine and violation.
Good idea. Let's start with Michelle.
From what I have heard this evening, I have not heard definitive proof that we know for sure that there was or was not social distancing in the house.
Okay. Patrick?
I agree with Michelle. I don't think that there is clear 100% proof that there was not social distancing. So I'm not necessarily sure if we can move forward with this one.
Daphne?
I'm going to go with the group. I know from what the officer said that he witnessed outdoor there was social distancing. So we were not there, so to tell what was going on in the inside.
Max?
Yeah, so I agree with the group as well. I will say, though, that in a 5,000 square foot house, my guess is that maybe half of it was being used for this party. And if there are 100 people in there, it'd be hard to maintain 6 feet between everybody all the time, but you can't prove it. So I'll agree with the group.
Doesn't matter what we believe. It's a question of, certainly from my perspective, what we can prove. And the other 4 members of the Board of Health don't feel that there was sufficient information to approve this fine. Brian, you want to comment on it at all?
I am in line with Max on this one. So that's just my 2 cents. If you have a party with over 100 people in a house, it's very difficult to keep people 6 feet apart. That's all.
But no one was in the house. Although logic says that it's very difficult to keep people 6 feet apart.
Aren't you an engineer?
I'm an engineer. I'm not a lawyer, and I'm delighted that Susan is with us right now because she is a lawyer. So the question to the board is: should there be a fine for not maintaining social distancing in the house or outside the house? Michelle?
I'm happy to let Patrick go.
Gee, thanks. I mean, I agree with everybody that logic says that, that amount of people in a house, inside and outside, that social distancing is likely not occurring. But unless we see clear evidence, either from one of the police officers or their report, or Adam saying that there truly was not social distancing happening, I don't think we can act on this.
Daphne?
I'm on mute. I think there should be a fine, but not a lesser fine because of the logic of just having a party when you're not supposed to, but also to if having over 100 people and having a party knowing that some of them wouldn't social distance, so maybe not so much of a fine, but I think there should be a fine.
Max?
Yeah, no, I agree with Patrick. I mean, I don't think you can put a fine on this one.
Michelle? I haven't forgotten you.
No, I know. I have to say I'm honestly torn between either part or none on this one. I do believe we're making assumptions, and so therefore that leads me to lean more towards none.
So we need a motion to either accept this fine or waive this fine, one or the other. So let me start with waiving this fine. Will someone on just social distancing? Will someone make that motion, please? To waive the fine?
Yeah, I'll motion to waive it.
Okay, you make that motion, okay?
Yeah.
Is that motion seconded?
Second.
Okay, all those in favor of waiving this portion of the fine regarding social distancing, say aye.
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 All those opposed, say no. The ayes have it. That portion of the fine is waived. The last one is wearing mask. Again, we don't know what happened in the house. And we really don't know what happened outside. It doesn't appear that we know what happened outside as far as gatherings, but it does appear that at least some people were going into the house without wearing a mask. So there are things we know and things we don't know. And yet there is a fine associated with not wearing the mask. I want to start again with you, Michelle. What's your feeling on this?
Two thoughts on it. One is that we did hear some documented non-mask wearing outside, and second, inside with this amount of people, a party atmosphere with drinking and food, I would assume it was impossible to keep mask usage at all times.
Okay. Patrick?
I actually have a question for Brian. Does the, you know how in the restaurants, the rule is that once there is food in front of you, you can take your mask off. Does that apply to private property as well, or is there any specifics on private property?
No, that's only in the restaurant sector specific guidance regarding restaurants.
Okay, thanks. Yeah, there was one point when Adam was talking that he said the majority of people in the house were wearing a masks, but I also agree with Michelle that, so meaning that when he said majority, that there probably were people that were not wearing masks. And then what the officer was talking about, the 10 women coming up onto the property without wearing masks, I think there's a little bit more of conclusive evidence. So I would, this seems to have a little bit more weight behind it than the last one.
Okay. Daphne?
I am just thinking about what Adam said about, sometimes like being responsible for adults. I understand that they were invited to his property and of course we're responsible for folks that were invited, but I don't think that I would, you know, keep the fine based on that because there's not really 100% proof that we can say everyone wasn't wearing a mask or whatnot. And I think based on what he said, he tried his best to have some people wear masks based on waivers and so forth. So I would go against it based on that.
Max?
Yeah, I think I agree with what others have said about it's highly unlikely that people wore a mask inside the party. If, at least that it was more enough people to warrant enough to forego this fine. I think that the mask wearing should hold.
Unless someone disagrees, I think we need a motion on this. And understand, even if the motion is to keep in place the fine, there can be a follow-up motion to look at the fine itself, which can be lowered. So having said that, need a motion for leaving in place the fine for not wearing masks. Would someone make that motion, please?
I'll make that motion, Joe.
Okay, is there a second?
I'll second.
Okay. So motion made and seconded to leave in place the fine for not wearing mask. Those in favor say aye.
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 Those who are not in favor say no. So the motion passed for a fine for not wearing the mask. Let's consider a second motion for the amount of this fine. Should it stay as it is, $1,000 for Mass General Law or against Mass General Law, and $300 for the town, or should that be changed? Michelle, again, I'm going to start with you. What's your feeling on that, Michelle?
My recommendation would be we keep the $1,300 for the fine for the number of participants, that we waive the full amount for social distancing, and that we keep the minimum amount for mask, which is $300. So my recommendation would be a $1,600 fine.
Minimum. Okay, so we're taking this one at a time. So basically, what you're talking about is, because we already have motions on the other two, but you're talking about wearing masks, reducing the fine from $1,000 to $1,300 to $300. Patrick?
I was actually had the same thought as Michelle.
Okay. Daphne?
I agree with my counterpart.
Okay. Max?
Well, I'm trying to understand the logic of a reduction. To be perfectly honest, Joe, I don't quite get it. So I would prefer to stick it where it is, but I'm happy to hear logic about why we would reduce this fine.
Well, I defer to the other three members of the board who have who feel that it should be reduced from $1,300 to $300. So, Michelle, I want to talk a little bit about your feeling of logic behind that reduction.
Yeah, I was just waiving the $1,000 fee and keeping the $300 one.
And why do you feel that way?
Just based on the comments we made and just going for a partial decision on that instead of going for an arbitrary number in the middle, I figured I would just break down the two charges and was going for the one that was more lenient.
Patrick?
My rationale was basic, the facts that were presented to us, the only thing that was truly proven by a third party was when the officers were talking about those women coming onto the property not wearing masks. So if you took those 10 women and that we knew that were not wearing masks, but we truly, by proven fact, all logic makes, we believe that people were not wearing masks in the house, But again, you can't prove that. I'm going off of just what the officer says, which was 10 people on the property not wearing masks.
Daphne?
I'm going solely by the second motion that we dismissed. So that's why my decision came on that.
And basically, your decision is to support reducing the fine from $1,300 to $300. Am I correct?
Okay, let me correct myself. I would like to keep that fine, but since we're dismissing it, I think the $1,500 fine should stick. But we are dismissing the second case, so I would like to keep the fine of the third for the $1,500.
The third one would be $1,300. The first that we,
Right.
the first is $1,300. This one here, you want to keep at $1,300 and not
That's
reduce to, and not reduce to $300.
That
Okay.
reduce it to $300. Yes,
Okay.
correction.
Max?
Yeah, no, I understand the logic, Patrick, about we only know what we know, which is those 10 people. But I still think that that given the preponderance of the likelihood that people were not wearing masks, I still believe that we should keep it where it is.
Okay, so we need a motion to leave the fine as is. Would someone make that motion, please? For not wearing masks.
Motion to keep the mask as is.
Is it seconded?
Yeah, I'll second that, Joe.
Okay. All those in favor say aye.
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 All those who disapprove say no.
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 Okay, in this case, there are 2 approvals and 2 disapprovals. So it's up to the chair on any board who has the final say on this when it's split. I'm in favor of reducing the fine from $1,300 to $300. The first fine for the number of people will remain in place, and this one here will be reduced to $300. Before we vote on that, though, because Brian has had his fingerprints all over this, and I tell you, Brian has done such a stellar job in our department. Brian, would you have any problems with this at all?
No, if that's what you guys want to do as a board, then by all means.
Okay, so that is it. So the fine from $1,300 to $300 for not wearing a mask has been approved. The fine for $1,300 for not for having a lot of people there has been approved, and the fine $1,300 for not maintaining social distance has not been approved. Am I missing anything here? Is that it? Concerning this hearing?
You guys voted on all 3 of them?
Okay, that's it?
Yep, you voted on all 3, right?
Yes, they did.
Yeah.
I think you covered it all.
Yeah,
All right.
okay, so the total fine will be $1,600, Brian, on this,
Okay.
down from $3,900. Unless there's further comment, that's the end of the hearing part of our meeting. At that, I thank you, Adam, and just be more careful going forward.
Will do. I appreciate the help, guys. Thank you. Sorry.
Good enough.
What happened.
No worries. Thank you.
One last question. Will I just get a letter in the mail, or how do I go about taking care of that?
I can send you a letter in the mail, yeah. Summarizing the vote and total fine.
Got it. Okay. Thanks so much.
Thank you.
That's the end of the hearing, as I said. Now we're moving on to, and Susan, you're welcome to stay for the end of the meeting, or you may have already signed off, I don't know. But going back to regular meeting communication announcements and discussions. Obviously, the big issue is the COVID-19 update. Brian, it's all yours.
All right, thanks. I'll try to keep it quick and brief. It's getting late, but I'll give you a rundown of what's going on. Overall, as you guys know, Mass has been trending downward, which is a great thing. Going in the right direction since the post-holiday spike. Today, North Andover has about 38 positive active cases, not including 9 at Merrimack College. This is down from, like I said, our post-holiday spike. We were at about 260 active cases. So this has gone way down since then. We are currently seeing less than 10 per day active new cases come through. We actually haven't seen 10 cases a day in over 2 weeks. So it's under 10 every day. And this is from 2 months ago, it was 30 to 40 per day, which was just insane. Mass as a state reported 1,900 new cases today out of 118,000 tests. So testing is still through the roof. They're doing over 100,000 a day. The percent positivity rate is at 1.8% over a 7-day period, which is far below what it was back over the holidays. Hospitalizations is down to 853, which is also on the downward trend as well. There's definitely been a shift more towards clinics and vaccinations than testing, but the testing is still going strong. So the main focus for the news and discussions and what we're working on now is vaccinations and the vaccine and education on that. Right now, as of today, we've completed several clinics. I'll let Caroline get into the specifics on those in a little bit. I will say that we have completed our first responders. So PD, fire department, emergency management, clinic staff, nursing staff, things like that have already been done as part of phase 1. Phase 1 has moved on to phase 2. So healthcare workers, first responders, long-term care facilities have all been done and taken care of. And then we're actually just finishing up phase 1. We're in the final stages of that now, and the state opened up to phase 2. Group 1 and phase 2 was 75 and over. And this opening was a mess. It was dropped on us like a bomb. We weren't ready for it. We didn't know that they were going to do certain things that they did, such as the 75 and over elderly population. They allowed to sign up for clinics, but it was only done online. So booking appointments online for people 75 and over was challenging. The state did not have their 211 assistance line set up yet when they opened up to 75 and over. So our office got completely inundated with calls. Actually, town hall, fire department, everybody got calls by the thousands. So our phones basically blew up, and we had to try to regroup and figure out how to take care of everything. We made do and shifted on the fly. And we basically pulled data at this point from the senior center, from the town clerk's office, from the police department and their rave alert information on residents in town to come up with basically a spreadsheet of seniors who are 75 and over and residents in town here. And there's almost 2,000. So we basically ticked that spreadsheet and went through and got people's numbers and started making phone calls to give them assistance on how to get sign up for clinic online, which is definitely a huge feat. So I got to give special thanks to the town staff here. I know several of the members and admins throughout the building worked tirelessly to help us get in contact with seniors, get their information. And we basically found out who needed a vaccine, who wanted it, what assistance they needed to get it, whether they can only do something in town, if they go to one of the mass vaccination sites in Massachusetts, such as Danvers or Lawrence General, were they homebound, and compile this information, try to work off of that to reach out and get the most susceptible and needy seniors vaccinated. So Lori Burzlaff in the town manager's office, the town manager, Bonnie in the planning department, the whole town clerk's office, Joanna at the Stevens Estate, literally worked tirelessly to get us the information we needed to do this outreach. So that was awesome. So we've been basically calling seniors since then to get them onto lists, to find out what they needed, to get them signed up for clinics. And we've had a lot of success, actually. And we'll talk about that in a little bit. We also found out that we aren't getting any more vaccine on a local level at this point. All the vaccine the state is getting, which isn't very much, is being diverted to healthcare centers, hospitals, and the mass vaccination sites. And at that same time, they opened it up to 65 and over, which is another whole subset of our population. We're trying to help get into these sites, find them appointments since we can't do it here. And then we're also partnering up with different types of entities. I've been in contact with CVS as well as Greater Lawrence Family Health Center on getting clinics set up for our residents. The Greater Lawrence Family Health Center did our youth center clinic last Saturday, which was awesome. So I get to meet with them and talk to them personally. They seem very excited to help us out and set up ongoing clinics here in town, as well as when we open up to the next phase, public works, educators, town hall staff that are over 65, and get some things done in town here for water treatment plant, some of the infrastructure and some of the utilities that are listed in the next phase in group 2, in phase 2. So Lawrence General Hospital has appointments coming on as we move forward and as they get more vaccine. Danvers has the mega site that's closest to us. Pharmacies are getting vaccine now as well. And then Greater Lawrence Family Health Center is another option to partner up with them. So our CVS here in Main Street should be getting vaccine in the very near future and getting appointments set up online. So we have our list. We'll be calling people when these appointments open up and get them taken care of. Myself and some of the health directors in the North Shore did an educational video for the mega site in Danvers, just to give an overview and a little instruction and frequently asked questions, and to get information over to people that can take a look at that and can get there. It was fun to do. It was great to work with my colleagues, and I think we did a great job. Just to pat myself on the back. And I'm going to pass it off to Caroline so she can give you all of the information on the clinics that she held. Super successful, and they went off fantastic. So I'll let her take it over.
Thanks, Brian. So as Brian said, we had just finished our first responder clinics. We vaccinated about 120 fire, police. We had nursing staff there. We had physical therapy, OT, and speech language therapists. They've all received their second dose of Moderna. And then when phase 2, step 1 opened up, we started vaccinating and independent living in town. And we also held a clinic at Merrimack College on Saturday for 75 and older. And between that, we also ran a kind of a mini clinic in my office yesterday and did a few homebound shots yesterday. So between all of that, we've vaccinated close to 400, 65 and older. And that's not including the Greater Lawrence Family Health Center that came in and vaccinated 400 people on Saturday as well. So, and I am able to get into the immunization system, and I know a lot of people are already getting vaccine. They're getting it at other places. It was a huge undertaking calling everyone, but everyone is so appreciative. Like Brian said, Lori and Tony, Trudy, everyone has been, Joanna was just so instrumental in getting these appointments made and, touching base with these seniors because they don't have access to the internet. They don't have email. They're not able to navigate the system. And so Brian was even chauffeuring people back and forth to the Merrimack clinic. So, everyone, it was all hands on deck, and it's been a great experience. So, and as far as vaccine to come in, we don't have anything other than second doses lined up. I did try to hold on to 10, 20 doses to try to get those homebound seniors that, won't be able to get out to clinics and everything. So we're working through that list and still getting calls. We were able to book another 10 people today. The elder services had 10 appointments available through the Tewksbury Senior Center. So Irene, the Senior Center Director, forwarded that on to me, and Tony was a huge help to try to get all of those booked for next week. So just trying to do every little bit that we can.
Nice. And just to follow up with that, obviously, if we hear anything additional about vaccine clinics opening up, we will get the word out there as best we can. We will help people sign up for clinics, and we'll keep you posted on if the state changes their mind and can get us vaccine to hold our own clinics. We'll definitely let you know. I know that Johnson & Johnson is going through their approvals right now. That may be coming out soon, and they're ramping up production. So when they do get approvals, they can send it out, and that will help our supply. Massachusetts is only getting 130,000 first doses per week from the federal government, and they have requests of 450,000 from all the healthcare providers, such as local health departments, coming in. So they can't meet the demand with the supply that they have. They're doing their best, but limited supply, huge demand. We just got to chip away at it and keep doing what we're doing. The state is also opening up. The reopening phase is moving forward as of Monday. Steve has all the details on this, so I'll pass it off to Steve, and he can give you a rundown as to what he's doing. A letter he's working on that's going to be coming from you, the board, to the governor's office about our vaccine allotment, and as well as all of the details on the phase reopening step 2, phase 3, and phase 4 coming up later on. So, Steve, you're up. Having trouble unmuting.
Can you guys hear me?
Yep.
Oh, awesome. Sorry. Yeah, so today we had a state call at 9 a.m. and then shortly later, I think it was around 1, Governor Baker came out and announced this. But Massachusetts is moving into phase 3, step 2 on March 1st, which is this Monday. They haven't released all the details yet as far as like sector specific guidance that we've been getting for different areas. But some of the areas they touched on were involving indoor performance venues, indoor recreational activities. They noted a lot of capacity limits will be raised. I believe they said to 50% in many areas. And then one area they touched on too was restaurants. For a little bit, they had gone to a percentage-based capacity. When this all started, they limited capacity by only allowing you to have as many people inside the restaurant based on how you could space your tables and meet the 6-foot requirement. Then they went to a different capacity where they went to a percentage based. They knocked it down to 25 for a little bit, but they're getting rid of that. I think they went up to 40% for a little bit. And now, again, they're getting rid of the percentage based capacity. So they're going back to where they were when they started, which is as many people as you can fit, meeting the 6-foot spacing, as well as other requirements. The 6-person table limit should still be in effect with the 90-minute time limits on tables. And then Governor Baker also announced, again, this is tentative, but the planned phase 4 date is March 22nd, which is great. That is going to allow basically indoor and outdoor stadiums, arenas, and ballparks to open up. From what I'm hearing, about 12% capacity. And then some other areas, limit on event venues and public-based settings, the capacity requirements could be raised. And dance floors at weddings and other events are allowed. But as Brian had mentioned, I was working on a letter to send to the state from the board. Basically, other communities, just to name a couple, the town of GovCAM and Abington had already sent out letters, and then the Massachusetts Municipal Association sent out a letter to the governor regarding the decision Brian and Caroline touched on about not distributing more vaccine doses to local boards of health. Just to summarize it, because it is about a page and a half right now, and obviously it's still a draft, so I'm very happy to take your comments on it. But we feel this could present additional barriers for residents. For example, like Ryan said, seniors are eligible, so 65 plus, and before that it was 75 plus, and registering for these things aren't the easiest, never mind when you have barriers to technology or issues using technology. And then also just traveling to these clinics. A lot of them are 30 to 45 minutes at closest, and a lot of them fill up appointment-wise pretty quickly. And yeah, just to touch on what Caroline said, the clinic on the 20th of February was awesome. We got a lot of good feedback from the public at the event and afterwards. They have been doing additional clinics as well. And just to summarize, like we do feel mass vaccination clinics are useful, which the state said they were going to focus on. But there is a key element to maintaining an ability at the local level to vaccinate and just be readily available for our residents. Again, that letter is just in a draft form right now, and I'm happy to send it out to you guys and the board, and also to Suzanne Egan, just to basically review and add any comments before we do anything with it. And then just to quickly cruise through what we've been doing in town, I was on vacation for a little bit, but I got back, and there's been a couple restaurants still either opening up or looking to open. Bird and Wolf has been in progress for a while, and they look like they're gearing up. Jet Nutrition is up and running on Main Street. We have a couple new restaurants looking to come into town, and they're working on either getting ready to build or finalizing their restaurant. One is going to be across from Main Street where House of Pizza was, called, the new restaurant is Fabiano's. I believe it's Pizza, Seafood, and Grill. And then we have, it's an Indian takeout restaurant called Indulge India that's going to be opening in the Chickering Plaza, or looking to open across from the Hafner's gas station. We're still doing inspections. They've kind of died down a little bit, especially with the septic season coming to a close. There's an occasional housing inspections, a couple awful haulers, and mobile food. Complaints have died down as well. We did issue a couple fines recently due to the mask violations. But luckily, again, complaints in general have died down. We're still permitting people. Food permitting is due on Sunday for all food establishments in town. We just finished septic installer and inspectors, as well as trash haulers and awful haulers. And then outside of that, we've just been trying to basically answer any questions we get from the residents. Like Brian had touched on, a lot of those were involving vaccines. And some of them still pertain to the state guidance on travel orders and sector-specific guidance. And then I just wanted to say, like Brian and Caroline had, thank you to all the town employees who have basically helped us in outreach, just to reach different residents in town to help register them for vaccination appointments. And just give a quick shout out to Tony, who was still calling people today when I was actually going home to help register people in different clinics around Mass. So that's about it on my part, though.
Well, thank you, Brian, Steve, Calvin, and Tony. Good work, as always, as always. I just want to make a comment on herding, and then I'll turn it over to other board members before we adjourn. Max Tilson, a member of our board, he's with us right now, and he is a physician. He said at the last Board of Health meeting that herding may occur in the fall. And present mass data shows that it could be sooner, which he didn't know, obviously, last month. Let me give you some examples why it could be sooner. The 7-day average positivity rate is down to 1.89%. The hospitalizations are down to 875, and this is in Massachusetts. The deaths, and this is information in today's Boston Globe, 60. Also in the Globe, the age of hospitalized patients at 69, and that age continues to go down as more seniors are being vaccinated. Many months ago, I read that it was 82 years old. Now it's down to 69. In Massachusetts, and I'm looking at it from, I know most of the people on the board and certainly in the department, they have a medical background. I do not, but I'm an engineer and I look at numbers. And in Massachusetts, over 1.5 million vaccinations have been given. Of those vaccinations, over 1 million for the first shot and somewhat under 500,000 for the second shot. And furthermore, in that over 500,000 people in Massachusetts have contacted the virus. So that is about 50%, the people that have been vaccinated and people that have contacted the virus. That's about 50% of the 4 million people who will be eligible to be vaccinated or have been vaccinated or have caught the vaccine. 50% right now, and they're talking about herding 70, 80+%. And this number, 50%, doesn't include people who had the virus but didn't know that they had the virus, or people who are immune to the virus. So herding could occur real soon. I don't care what the politicians say. I'm just going by the numbers. Herding can occur real soon, perhaps as early as this fall. I hope that I'm not wrong, but that's what the numbers say to me. And if anyone, certainly one of our doctors, disagree with this and would like to hear further from them. At that, are there comments to be made by anyone on anything concerning the coronavirus and the vaccine?
I'll just put it out there. Thanks to Caroline, Brian, Stephen, and Tony for all your hard work on all this. It's greatly appreciated. And it's been a long meeting, so I won't say anything else.
Good, good. So at that, I need a motion.
I'll motion to adjourn.
Is there a second?
Second.
All those in favor say aye.
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 Those opposed say no. The motion is adjourned. Thank you and have a good evening.